So welcome to Period State of the Period Education event in honor of Period Action Day. My name is Reagan Moss. I use she, her pronouns, and I am a youth advisory council member for Period and a community organizer. And during college, I founded a chapter of Period based in Alabama. Period stigma and a lack of menstrual health education have impacted students, families, policies all across the US. I'm sure all of us tuning in have been impacted in some way. And to truly make a lasting impact, it is essential that we talk about periods at home, in the classroom, and in our everyday lives. So today we're going to be discussing how menstrual health education, or the lack of, has impacted young people within the United States. And we're going to discuss some examples of how we can break this cycle and truly create some lasting change. We are joined by several wonderful panelists. So I'm going to hand the mic over to them so that they can introduce themselves. We'll start off with Dr. Marnie Sommer, an associate professor of socio-medical sciences at Columbia University, followed by our Period 2022 Youth Champion Award winner in education, Samia Sao, and ending with Julia Lichtenberg, an independent school nurse, consultant, and board director for the National Association of School Nurses. So for those who may not know about you, if you all could tell us a bit about yourself and your work in relation to menstrual health education specifically.
Sure. My name is Marnie Sommer. I'm a professor at the Columbia University School of Public Health, and I've been doing research and projects on menstruation and specifically menstrual health and hygiene education and response since 2004. Along with the work that I do at Columbia, I also have a nonprofit called Grow and Know that has developed puberty books in 10 or 11 countries around the world. And most recently, we launched our first book in the USA, which I conveniently have right behind me. It's in English and Spanish, and these books are based on doing participatory research with young people across the country, wherever we happen to be doing it. So it's a delight to be here today. Thank you so much for including me.
Hi, everyone. My name's Samia. My pronouns are she, they, and I am really honored to be invited to talk with you all today. I have a background in undergrad in global health and gender studies, and really found a passion for kind of the intersection of gender and health during college. So after college, started working in a setting that introduced me specifically to adolescent health. And I found myself becoming really passionate about figuring out how to make access to adolescent sexual and reproductive health better for young people. And I am based in Baltimore, Maryland now. So I am going to be able to share with you a little bit about my work specifically related to menstrual health and menstrual health education through my nonprofit called the Violet Project. And essentially it's an organization designed to empower young folks to learn more about their bodies and about autonomy, and to kind of just tackle reproductive health stigma together. So yeah, I'm very excited to hear everyone's the discussion today.
Hello, my name is Julia Lichtenberg. I am the Michigan delegate to the National Association of School Nurses. I've been a registered nurse for over 40 years, with 23 of those years in school health, directly in school nursing. I've had various hats in school nursing, one as one-on-one care. So I provided a lot of care directly to students with questions about menstruation, health education, reproductive health, that sort of thing. And then also on the district level. So that was a little bit different, but now I'm an independent school nurse consultant. So I just provide trainings and that sort of thing.
Great. Thank you all so much for introducing yourselves. It's really exciting that we get to have so many people across different fields with intersecting interests. And I'm excited for the rest of our discussion. So although we've come a long way talking about periods and menstrual health, both are still incredibly stigmatized. So what inspired you all to get involved in this work, and why is menstrual health education so important to you?
So I was inspired to get involved many years ago, about 24 years ago, when I was a Peace Corps volunteer teaching English in a small village in the Horn of Africa in a country called Eritrea. And in the rural community where I was teaching, my students, the female students, came to school. They were corresponding to, I would say, middle school students and upper school students or high school students in America. Many of them would walk an hour to get to school. They would be sitting in the classroom for 6 or 7 hours. There were no toilets on the school compound. And I always wondered, what did they do all day? Where did they go? They had no chance. There was no bathroom. How did they manage? The most determined and dedicated students were there the whole time. But some of them, definitely started to go missing. And so I used to think about it. It wasn't until many years later when I became a doctoral student at Columbia studying public health that I went in to examine this intersection with girls' education, because I was really sort of focused on this issue of periods. And I wanted to know, what did they learn? What did they not learn? Did anyone talk to them? Were there toilets? Sort of the whole range of things. So that's really what inspired me. Plus my own period, and just identifying with what these girls maybe had to manage, and the female teachers, because we had one Eritrean female teacher, and it took me a while to figure out why she was absent for a week every month. There was no toilet for the teachers either. And she had really bad cramps and bleeding. So it took me 3 or 4 months to realize that that was why people would just say, well, she's not feeling well. It was all euphemisms, to your point about stigma. So those were the various things that inspired me.
Yeah, so slightly similarly, but I kind of learned about all of these these crazy stories kind of globally about how like female folks, like they just don't have access to education, and like how it can manifest in such like really powerful and kind of traumatizing ways. And that's kind of what first, through like books I was reading, what like brought me into this field. When I started working with adolescents in particular, and like still being a young adult myself, I like found myself looking back a lot to like middle school and high school and things that I'd experienced. And I like still remember when I was in 7th grade, my family went to India to visit all of our relatives, and I got my period while we were at my like dad's family's house, and I wasn't allowed in like specific rooms, and it was just kind of like, it was just like, that's how it is. And I wasn't allowed in my grandfather's room because the little temple was in his room, and it was literally just for the week that I was on my period. And it was like really uncomfortable at the time, but I didn't really understand why. And it wasn't until I got older that I realized just like how many different situations I'd been in where this stuff was so heavily stigmatized. Even just like having to like smuggle a tampon like in my jacket to like go to the bathroom in middle school. And when I started working with people who were in high school, kind of as like a little bit of an older person, I realized like it was still just like there, nothing had changed. Like it was still so insanely stigmatized. But there were so many young people who like are wanting to make change. And that's like what really made me passionate about this field, is like getting to work with other people who we can kind of like start to conceptualize this differently. We like I was working with a couple of my high school students, and we were trying to come up with some sort of like metaphor, or like to kind of just like show how ridiculous it is that we have to suffer through periods and also pay for our period products. And we literally couldn't think of anything in the world that's like similar to how our world treats menstruation. And it's like, it's really because it's so unique. It's like one of the only things that like you're kind of just stuck with it if you're born with like menstruating, and then we're forced to pay for it. It's kind of like periods, the shirts that say born with a uterus, born into debt. So yeah, sorry, I've been talking for a while, but that's kind of what made me passionate about this field.
Well, my organization, the National Association of School Nurses, we advocate for health equity for all. We are committed to health equity for all, including equity for people who menstruate. The interesting thing is that 3 years ago, as a group, our board of directors read, and we actually discussed the book Period Power. So this was kind of on our radar anyway. Very interesting that it all came full circle for us. You know, as a school nurse, we understand that poor menstrual hygiene, you know, caused by lack of education on this issue, those persistent taboos that you were just talking about, stigma related to menstruation, limited access. They don't have access to the personal hygiene products that they need. These kids are missing school. They're missing 2 to 3 days of school a month. 10% of the month, they're missing academic days. This is impacting their educational opportunities. That's why I'm so passionate. These kids are missing school that should not be missing school.
So as you all are sharing about how the current state of menstrual education is impacting students all across the globe and within your own nonprofit settings or like research settings, I'd like to throw it back to when you all were learning about your periods for the first time. What did menstrual education look like for you, and how might you have preferred it to have been if it wasn't the best experience?
So I don't entirely remember, which also maybe says something. I mean, it's been a while. I do remember I went to an all-girls school, and we definitely had some kind of session on biology in elementary school, but I could not tell you what it was and who taught it and really anything about it, except that there was some kind of video and it felt awkward. What I also do remember is that when I was 12 and got my first period and woke up and there was stains on the bed, I just burst into tears. And we was just so unhappy and ran to get my mother, and which of course not every young person is comfortable doing. And so it was an upsetting moment for me. That sticks with me. The other piece I remember is reading a lot of Judy Blume books that helped me to relate in a private way to the changes that were happening to my body. And so that's why many years later, I thought, well, at least in the countries where I was working at the time, you know, in Africa and Asia, and now here in the US, I think about it. If young people don't have a resource, don't have a teacher who is comfortable talking about it, or access to a healthcare worker who may or may not bring it up, because I don't think a lot of people, doctors here in the US necessarily provide any guidance, then at least we can give them a book or something so they can start to understand for themselves and then go seek out the answers of additional questions. So that's what I remember, and or the gaps and the things I liked. And I think the only other thing I'd add is, what I did remember is that as a young person, hearing from older women, young women, older adolescents, people a little older self, I really trusted. I would look up to them and their advice. Not to say my mother wasn't important. And so the way we designed our books was we collect girls' first period stories from across the countries where we do the books. And so it's very much older girls talking to younger girls around how did they feel, what did they, do? How did they manage? What is their advice for younger girls? It's always a key part of the stories that we include, because I think it builds young people's confidence sometimes to hear, oh, I'm not the only one that's nervous or scared or didn't know who to talk to. And it's really telling to me. We collected stories from 25 states for the development of the book, how similar those experiences of being surprised and ashamed or unhappy were here in the US along with overseas. So just to sum up, I think that tells me we still have, I know we have a long way to go in improving the menstrual health education that young people get today. And that is definitely comes out of my own experience to some degree.
I got my period a bit on the younger side of the window. I was still in elementary school, and I didn't really notice anything. I got it, like, I guess during the day in the school day, and I came home and my mom just like immediately started crying, because I think she thought that like she was just so unprepared for me to get it. Like, I was 9, and because she like her reaction to it was crying, I was like, there's something like definitely wrong with me, and it was like extremely freaky. I also like, it was very much a like, don't tell anyone that this is happening to you, because it was like almost like looked down upon that I had like already gotten it. And I just remember for several years after that, it just being like such a hush hush thing, which is just weird. And I like, Marty, how you were just talking about hearing from older folks, like older menstruators. I think that is one thing that like really stands out to me, that there was just no discussion about it whatsoever. I grew up in Florida, so maybe that's like part of the reason why, but we didn't have like anything in middle school. And then the one thing that we got in high school was pretty much just like shaming folks to not have sex, and didn't have anything to do with menstrual health at all. And I just remember always just being like really scared that I would be like in the bathroom and people would be like, why are they in the bathroom for like that long? Or like be like going to going like out with my family for the weekend, and like my brother just wouldn't understand like why. He would be like, why is this taking so long to get ready in the morning, and like why is she just like lying in her bed in pain, and like not having any understanding, and also like just not being allowed to say that like this is a thing that happens, it's like a biological thing, and that is why I'm in pain. Like I wasn't allowed to talk to it, or like to tell my brother about it or anything like that. So yeah, I remember it, my first years of having my period being like really there. It was a very taboo subject. Yeah.
Well, the interesting thing is that I couldn't remember any of this. I couldn't remember any type of education that was offered in school. So I actually picked up the telephone and I called other people that went to school with me. I called my siblings. Do you remember anything? We absolutely, to the best of our knowledge, don't remember any class at all related to reproductive health, menstruation, nothing. Now, granted, it's been a long time, guys, that could be it, but I have no recollection at all of any type of formal class. As far as where did I learn about my period? Unfortunately, I learned about it on the playground. I didn't learn from my mother when I actually had my first period. I remember telling my mother, and she said, "Do you know what's going on?" And I said, "Yes." And that was it. And what does a 12-year-old know? Not much. Not much. So, I just had very limited knowledge, but still, there was a stigma attached to it. We didn't discuss it. We didn't talk about it. That was just the way it was at that time. So I'm glad we're talking about it now.
So as you're mentioning the fact that you don't have any recollection of receiving any formal education, want to bring up this study from 2021 from Period and Thinks that found that 76% of students reported that they're taught more about the biology of frogs than the human female body in school. And it seems to resonate with you all's experience, but if you all could expand upon that a bit more and talk about what factors might be driving this finding, or what you're finding people don't know about menstruation because of this lack of education.
Yeah, I can speak a little bit about what we learned doing our Growing Girls study across the US. And we actually published one paper around our findings and another one about some of the gaps in knowledge just got accepted yesterday. So, and these will be open access. We'll pay for them to be available. So they should be out soon from our team here at Columbia. I think that one thing we've learned, one was what we learned from the girls, and another thing was what we learned from looking at what the policy and legislation is across the country. And there's a huge number of states in which there is no sex ed mandated. And I say sex ed because that is often what the legislation mandates, but I think that that in turn may hinder some of the puberty and menstrual health education reaching young people in districts or states where there is a discomfort with having sex ed in schools, particularly at the elementary school level, which is when we know many girls may get their first period, particularly sort of that average age of first period has gone down to 11.9. So that is definitely end of elementary. So I think when you look at the legislation that's out there, and there are a bunch of organizations that have posted about this or written about this, there's, maybe like least 20, I don't remember the number of states that have no mandate to teach any kind of sex ed. And also there's no, in many states within the ones that do teach it, they don't have to teach medically accurate information, which is sort of astounding to me. And so one, you're starting with the fact that it's not mandated. And if it's not mandated, it's maybe hard to get schools to take it on because they have a lot on their plates. Maybe they don't think it's priority at the local level or the state level. And so it sort of can more easily be not included if that is the case. The other question, the other sort of aspect of that is what is actually happening within schools. Because if it's not mandated, even if it is mandated, from what we've understood is there's very little specifically to your point around that there was very little on menstruation when you were what you did learn in school. I think that a lot of these places maybe do sex ed or they do something, but they don't necessarily get into puberty and menstrual health. And it's not included, they're not sort of guided on that. So I think when you start to say at the state level, at the local level, this is a requirement and not one that feels punitive, but one that feels important to do for the benefit of the health over the life course of somebody who menstruates, I think then you maybe will start to see a shift because then it's something that's required. That does not mean I think young people should get tested on periods of menstrual health, which I think is always, you know, when you start to mandate things, you want to make sure people don't think, oh, well, now we're going to give tests to show they learned it. But I think that will just scare people off from the subject. And really what you want to do, obviously, is empower them about their bodies and have them feel good. And then figuring out who should teach that. You know, is it the male phys ed teacher who oftentimes we learn from our research is the person who's given that role, and sometimes that doesn't go so well. Is it the school nurse who is, particularly since COVID, has no spare time, may not even be in every school. So, and really they should be there to provide clinical care for those who are in pain, or, you know, I will let my colleague talk about that. But so I think you look at what's sort of the curriculum within states and at the district level, and then you look at parents. Are parents allowing the content to be taught in schools? Some of what's been published shows that parents have to opt in for kids. They have to sign off on kids learning about puberty education, which seems interesting to me because it seems so fundamentally important. If you have to go and get a parent's signature for someone to learn this, then you immediately, anytime you create barriers in the system, you make it less likely to happen. So there's all the kind of structural school system, social structural issues that I think may be hindering it. You may have teachers that are not super comfortable. Or you may have students not comfortable with those teachers. And so then there needs to be better work done to figure out, well, who should be teaching them and what is the best way for them to learn. Other things we heard about from our research is that in some parts of the country, I think many, including in New York. So, you know, it doesn't matter if you grew up, no matter where in this country, I think all the states are struggling to some degree, I'm guessing. The videos they were shown were dated, they couldn't relate to them. It was an uncomfortable conversation. And they just overall, I think, couldn't relate to it. So either it was left out or maybe not delivered in a good way. The last thing I'll say is, well, the one thing I'll add is that we do have a website with first period stories we collected from 25 states, if anybody wants to see it. It's really interesting just to see those experiences and how similar they are. I, in fact, sent one to a colleague, a friend, to edit before we put it into the book. And she said, well, the story's so negative about this girl's experience. You know, can't you send me a positive one? I'm like, well, if we had more positive ones, I could. But I think what the book is showing is that a lot of girls don't have positive first experiences, and we need to change that. But at least in the meanwhile, they can relate to each other. So the only last thing I'll say is we're doing a study right now on young men's perceptions and understandings of menstruation here in New York, in the community around our school, our university. And a lot of the young men are saying, well, I didn't learn anything either, and are very confused, and still, you know, they're probably late teens, don't really understand that much and don't really know who to ask, or you know, so I think everybody needs to understand it better across the country. So those are some of the things that we've learned from our research.
Yeah, just to very briefly add on, I think something kind of at a local level that we've definitely been learning from high school students and from teachers here in like the greater Baltimore area is that when a teacher is, you know, just told like, okay, you're in charge of doing health for this grade for like this year, they just like they don't know the information themselves, and it just creates this like really terrible cycle where it's not being taught in school, so the current adults don't know it, and then they can't teach the current students, and then no one is learning this stuff. And it's really hard because these teachers have so much on their plate, and there's just so much. Like the first time I actually went into a Baltimore school and taught a lesson, like there is so much just like in the like day-to-day of school that is like so difficult to deal with already, that I think like expecting teachers to come up with their own like materials and learning this, all of this stuff that like they didn't get taught themselves is right. It's not like it's like an AP history textbook that you can just be like, okay, read pages, whatever to whatever. These teachers are like really having to like figure stuff out for themselves. And the other big thing is really that this stuff can be really just like challenging to teach, and it can be really uncomfortable to teach. I I thought I was like so confident in this material, and then the first time I stood up in front of a classroom of like a bunch of 15-year-olds, I was like having to like come up with exciting ways to keep them interested the entire time, and I was so overwhelmed. And it like takes a lot of it takes so much to like be familiar enough, I guess, with the content and like be comfortable enough with it to like make young folks who are still in such a like this stuff is still so taboo for them, to like make them like kind of engage. But the amazing thing is that when when they are given like a space with like a trusted adult, it's amazing how many of the students like opened up and asked questions and were like really, really willing to learn, and we're like glad to have someone they could talk to who will like answer their questions, and they can kind of like know that it's factual. So it's like, yeah, it's so hard, because when you can actually like get the education to these people, I feel like the like teens are so, they're like ready to learn, but it's like it takes so much to actually be able to, get in every single high school to have like a teacher who doesn't already have a million things going on, to like be able to teach this whole other curriculum that they're not necessarily given. Yeah, anyway, sorry.
Well, I have to smile as you're talking about that, because if you think about it, if you're not comfortable with the situation, how do we expect our kids to be comfortable with the situation when they come in and sit down, and this is a totally new subject for them, and we don't talk about this at home, and it's all taboo and that sort of thing. So that comfort level, truly, it's a big deal. It's a very big deal. I had a little bit different of a situation, because I actually provided care in elementary buildings. So I was tasked with going in there and doing, and it fell under our reproductive health, was I worked with fourth graders, fourth grade boys. I mean, then I look at this and think, well, why did we separate the boys and why do we separate the girls? I mean, we're still adding that stigma and that taboo that's related to menstruation. So that's just food for thought, food for thought.
So what are some of the tactics or methodologies that you all have learned about that can help when approaching this subject with a younger audience, an audience that menstruates, or maybe an audience that doesn't menstruate?
I think that's a great question. And also, I think it's really brave to walk into a classroom of 15-year-olds and start to talk about this. So you get lots of, I think in some ways it's easier to talk to the 9 and 10-year-olds, because they may giggle, but they'll just giggle. They won't, throw hard things at you to tackle. So well done on that. And that's actually something we found with our book. We slated it for 9 to 13 or 14-year-olds, but we actually found it's best for 9, 10, 11-year-olds. It's like those who are just starting to understand and don't know who to ask, and all that. So I think that's actually an answer to one of your questions, is figuring out which the age group is, and what is the right way to engage with them on the topic, whether you're teaching them or trying to learn from them. So for us, we do a lot of research with young people to understand about menstruation and their experiences. And we also do research with boys around wet dreams and erections and their experiences. And I can tell you that's not a lot more fun either. So just to say, not fun, but they have their own embarrassment and shame and discomfort asking. Probably they ask even less than those who menstruate do. So that's a whole other conversation for another day. I mentioned that only is that there is a solidarity if we enable it to happen, to your point about teaching kids together, so they can relate to all the weird body changes that they're not used to, that they have to adjust to and come with all this adult meaning that is like confusing to them at that age. But the methods that we've used to engage with young people that we found very effective, I haven't tried this in terms of research with 9, 10, 11-year-olds so much. It's usually with 15, 16, 17-year-olds, is we do, if they have the capacity, we do a lot of anonymous writing. Because I found that sometimes people don't want to say aloud, whether it's a one-on-one interview or a focus group in front of their peers. They don't want to, they're embarrassed maybe to say what happened, or they're going to shift that story a little because they, understandably, we all worry about the impression we're making on other people. And so one of the things we do in our research, in which we learn about young people, but we always end up answering their questions at the end of the research study to make sure we give back to them through the process, is on day one, as we're beginning, we give them little pieces of paper and pens, and we ask them, no matter what country we're in, from America to other countries, we ask them to write down their anonymous puberty questions. We just say, give us 2 or 3 questions about your bodies, growing up, things you want. And granted, these are 15, 16, 17-year-olds, so their questions skew a little older, but we then spend a lot of time answering those questions. And so they write it down and they fold it up and hand it in so that we will never know who wrote one question. So that is a way to really learn, what do they really want to know that maybe they don't want to ask. We also have them, and we do this with the boys too, when we do boys' books in other countries, but we have them write this, as I said, a first period story. And the anonymous first period story is another way for us to really understand what was their experience, who was involved, how alone did they feel, who did they seek out guidance from. And one of the things we intentionally did in our book is collect a real diversity, have a real diversity. So some young people went to a grandmother, some went to a father, just depended on where they were when it happened and who they were living with, and who was there to support them. Was it after school session? Was it a friend at school or not? And I think that these stories guide us in knowing where the gaps are, not just in their information, but the gaps are in their support. So when we read these stories and hear that their mother didn't talk to them, unclear why, it was taboo, culturally not done, she was uncomfortable, she was not around or in their life, it helps us to see, okay, where are all the places we need to try and fill in for when you try to think of all the young people in a given country and who may or may not be learning. That doesn't speak to those, who maybe learn best by video or other things. So we do have some animated puberty videos that we develop with the books, just to, again, for a very young audience, 9, 10, 11-year-olds, around some of these more embarrassing and uncomfortable things. But similarly, we always end with advice, because I think an advice that we've gotten from the young people around sort of how to solve for that issue. In terms of engaging the younger people, the way we designed this book, at least, was to be read alone, as I said earlier, because I do think there is something very powerful if you are able to read, to have that quiet time to really read and digest. And one of the things we've heard from our puberty book and from other puberty books that are out there is that sometimes a girl or a young person who menstruates will read it and then go away and come back and check sections. Because if they haven't had their first period, it doesn't sink in the same way as it may a half year later or a year later when they have had their first period. But to know it's on the shelf as a resource, which is my dream, is that everybody has a book at home to answer those questions when they're ready to have them answered. And then if a parent or adult in their life is able to be more supportive and answer questions, that's wonderful. But one of the things some of the literature shows is kids want to hear more from the parents. Parents think the kids don't want to hear from them and or are uncomfortable. And so, I used to think we had to deal with parents and solve for the parent issue. I've come a little away from that, because that's a big thing to take on, making parents more comfortable talking about body change, because for them it's very connected to sex and their kids growing up, and it's really laden. So while we obviously, I think, would love a world where parents are more comfortable, I feel like that actually might be harder than just trying to figure out other ways, whether it's a video or a book or a better teacher or a video, whatever it is, to help kids understand. But again, really important to target for the right age group and obviously their sort of learning capacity.
I mean, I can just add a little bit very briefly, but I guess some strategies we use when we are working with high schoolers is when something feels uncomfortable or they are kind of like making fun of the subject or like acting like grossed out about it, we try to just say like, this isn't gross because it's just our bodies, like it's just part of our biology. And we've done a lot of education with like people of all genders, and it's really like nice to see folks who don't menstruate like paying attention to the menstrual health education. There's this one thing that I'll always remember, which we were at a high school, and a guy asked, like he was like, we always do like an open Q&A to just like answer any questions, and he was like, can you like share something about period pain? And we like pulled up like a section of our website and like walked through some strategies on managing period pain, and he like took a picture of it was like projected, and he took a picture of it, and everyone was like kind of making fun of him for asking, but he was like, no, I'm asking for my girlfriend, who was like sitting right next to him. And it was really nice to like see like someone who doesn't menstruate like engaging, because he knows that it will help like people in his life who do menstruate. So yeah, I guess just like normalizing the subject so that people recognize that it's as much as it's been stigmatized before for you, it is just part of our body, and it is just like biology, and that's why we're learning it, so that you can feel comfortable with your own like body. Is I think, I don't know, one thing that's helped us a lot, just like making it more comfortable to talk about in a group setting. Yeah.
Well, these two have done a great job of describing what they've done. The one thing that I learned from experience working with younger children, especially, I would walk into a building and the child may have started they had their first period. They didn't know what was going on. And of course, the secretary would say, that one's on you, Julia. I learned from experience to contact the parent first before I had a conversation with their child, because not all parents want the school nurse to have that conversation. That was my big takeaway. Now, I will tell you that many times they were, please have that discussion, or can I come to the school and can we have that discussion together? So it was a good way to build relationships with my parents, but truly, I did learn that it was important, very, very important, to have that conversation with the parent before I just jumped in and I provided the education.
I love that baked good story. If everybody saw it in the chat, that's kind of amazing. Oh.
Yeah, I'm loving all of the chat engagement. And if anyone has any questions or comments for the panelists, feel free to throw them in the chat. Yes,
just one comment on what Julia said. I think that's one of the misconceptions, is people have this assumption that parents all want their kids to learn a certain, I just think we have a lot more work to do in understanding, what people really do and don't, what parents really do and don't want to learn, and help them to feel more comfortable with it, and to understand why it's like a lifelong health issue for people to really start to learn about at a young age. So anyway.
I would tell you that for the most part, these parents were very, very supportive, but I did learn to always take that initiative to make that contact first.
Yeah.
How do you all think the lack of education during adolescence, or maybe some myths that people learn during adolescence about menstruation, carries with them into their adult years as parents or maybe as politicians?
mean, sorry, Marnie.
Go ahead. No, go for it.
I was just one, like, I think one of the biggest things that we hear about from young people is this like concept around like virginity and how it relates to menstrual health. We do a lot of like period cup education, and like pretty like almost always the first, like if someone's like hesitant about it, it's related somehow to this like concept of virginity. And they always say it, like my mom or like my parent like told me like I can't use tampons because it means that, and then they'll say something about virginity. So it's like having like parents like beliefs of this stuff is having an effect on the like different types of products that young people think that they can use. And also like it's conflating like menstrual health, which is literally just something biological, with this concept of like what virginity means, or like this it's just like it's putting something that doesn't need to have like any sort of sexual connotation related like with it, and it's kind of like shaming people's like options just to like have a comfortable period. And it's yeah, and it's really disheartening when the young person is saying that, oh, it's because my parent told me that. Like obviously cultural things are like very different, but when it's something that's, you know, just like I'm not allowed to use tampons, or like I heard this rumor that like if you insert a tampon that means you're not a virgin anymore, things like that, that has been like a big like myth or something that we've heard about a lot, that I think if we can teach younger folks and older folks to not, you know, that these aren't true, then hopefully when they grow up and they become parents themselves, they'll have like, you know, a clearer idea of what to teach to their children.
Yeah, I would totally agree with that. I did when we were both in our research with the girls across the country. We did most of our research in New York, LA, and Chicago, with sort of a diverse group of adolescent girls. And then also I did some podcasts when we launched the book, and some of them I'm just watching the chat, were Latinx mothers. There is a lot of the beliefs around what products you can and can't use is they're very strong feelings. So I agree with that. The other thing I was going to say about the way maybe it shows up in adults that then impacts the young people who menstruate is I was on a call this morning with some adolescent medicine doctors here at Columbia, because we're sort of hashing out a project. And they were talking about how just that day in clinic, or often in clinic, maybe it wasn't all today, they will have young people who they ask, because these are adolescent medicine doctors, so they're pediatricians who are particularly trained to work with adolescents more than maybe the general pediatrician who's out there. So they will specifically ask about things that a general pediatrician might not, such as about their period, about products they use, about how they're managing. And so they told stories of young people saying, well, actually my cramps, I mean, this sort of gets back also to Julia's point, but sometimes my cramps are so bad, actually, I have to miss school. I've been missing school 1 day a month or 2 days a month. And the doctors were saying to me, no one else has ever asked them that. And so they don't, and they normalize it. Sorry, my whole point is they're like, well, but my mother was like that, or my grandmother, it's just in the family. And their point to me is, you know, maybe there is that pain in the family, but we can help them with medication. They don't need to be suffering. There is this normalization that, I mean, I had pain, a lot of pain when I was younger, just this normalization of what we have to deal with. And so I think that, so that you see it sort of trickle down through the generations in terms of what we accept. I think on the flip side, I used to go to this woman to cut my hair sometimes. And I remember her telling me one day, I just started asking her about periods because she had a 14-year-old daughter. And like, I just talked to everybody about periods, whether they want to or not. And so she said, I said, how is it for your daughter in school? Her daughter's in school in the Bronx. And she said, well, she gets really heavy periods and they're really strict about bathroom policy. So I told her, I don't care if you get a detention, you just walk out and go to the bathroom if you think you're going to have an accident. And her mother stood behind her, you know, no matter what the school did. And so I think bathroom policies in schools are complicated. I sympathize with the schools and I also sympathize with the menstruators. But, you know, I think the way the adult in your life conveys messaging and modeling to you, I think has a lot to do with that experience, you know, not 100%, but certainly so.
I'm sorry you guys went black for a moment there. I lost you on my screen entirely. Marnie actually covered most of what I was already going to discuss about menstruation carrying across the generations and that sort of thing. I mean, these students are missing way too much school. I mean, and then they go back and say, well, this happened to my mom, this happened to my grandmother, that sort of thing. They consider it a normal thing. I mean, and some of these kids truly are missing 2, 3, 4, maybe even 5 days of school. But going back to what Marnie has said about leaving to go to use the restroom and that sort of thing, communication, encouraging our parents to communicate, our students to communicate with us, because if we know there's an issue, we can take care of the issue, we can solve the issue, we can refer them to the physician, that sort of thing. And then if you really think about this, if we're not addressing this as a teen, we haven't addressed this as a mother, as a grandmother, what other underlying medical conditions are going on that we don't take to our physician? Could we have fibroids, endometriosis, that sort of thing?
What she said.
So I'm going to open the floor now for any audience questions. So if anyone is tuning in and wants to pop a question in the chat or come off mute, feel free to ask any or all of our panelists a question. Caveat first, though, if every panelist wouldn't mind putting into the chat, if there's any way for people listening to engage with your nonprofit, with a book, any other way they can support, if you could provide some links. But yeah, if any audience members have any questions, feel free to come off mute or drop them in the chat.
Okay, hello everyone. Hello, my name is Idris Jibrin. I'm from Africa, joining you. Like I see, thank you very much for the panelists. They have really tried for the topic. I learned a lot, very much. I learned a lot because, as I can see, I'm the only male here among you females here, and I really learned a lot because I'm an advocate here, trying to eliminate the period issues in my country here in Africa, because it is the stigmatization among my male female counterpart facing the female one is very, very high here in Africa. That's why I'm very determined here, and then trying to end the period poverty, because it's very, very high, and it's very expensive for the female genders to access the pad or the typhoon to use while they're menstruating, because some of them start trying to have having their menstruation at an early stage. And then please, my question goes to the finalists, like for the Marni, because how can we here in Africa try to collaborate more with the international bodies like you here there in the US? Because here it's always late, and then I try to join, and then schedule my time to join, and then late and all, please. Then my question goes like this: how can we collaborate here in Africa to the to the international bodies and try to eliminate it more here in Africa, because we can learn from you also.
Yeah, well, it's great to have you, and I know it's probably late in Nigeria right now. If you are joining us, I don't know if it's 4 or 5 hours ahead in the time zone. I think that Nigeria obviously is a big and complicated country. I will say that, but there are definitely initiatives in different countries in Africa that are doing things. For example, we'll be in Sierra Leone in November. We're working with an NGO and the Ministry of Education. We did 2 puberty books there, and we're doing a project to train teachers to feel more comfortable talking about this in the classroom, although there are a lot of system barriers, and I don't think we're going to be doing enough, but it's some learning. But I think in different countries, sometimes you have what's called MHM, menstrual hygiene management working groups, that are focusing on this issue in particular. They may not all be focusing on health and education. Some of them may be focusing on products or toilets, but I think that figuring out if Nigeria has an MHM working group. I know UNICEF did some work in Nigeria some years ago, and we did some work in the camps in the north. That may be another way to find out. But when we do puberty books in a given country for our organization, we find interested folks and we try to figure out how to do the book in a way that it will get approved by the government. So then the donors and the UN agencies and the government can start to order copies and really try to scale the books. We thought about Nigeria a few years ago and we got overwhelmed by the complexity. Do you do the North? Do you do the South? What language do you do? So anyway, but I also thought Nigerians are so, they get things done. So I sort of thought someone's just going to do it and we don't need to do it. But anyway, I'd be happy to connect with you on that. But there's also the Africa MHM group that's run out of South Africa, a sort of an Africa-wide menstrual health management sort of coalition that sometimes tries to connect on these issues. So there is a lot to do. I totally agree with you, but I think there's some good organizations to partner with. And so I think we can see change happen. So I congratulate you for what you're doing. And I think having, not just those who menstruate involved is really essential. So.
Okay, thank you very much. I really appreciate your answers. I'm very, very comfortable with that. Thank you. I really appreciate it. Yeah, thank you very much. Yeah, I'm in Africa because I'm in the northern part of the country, because that's here the stigmatization is very high and lack of education of it. And then you see a girl is trying to having her menstruation for the first time. You see the girl crying, then hiding herself, not going to school, always being indoors, trying to avoid people, and this will also lead to depression. Most of the girls they are having depression from this period, lack of knowledge about it, and then which they think maybe it's a disease that they catch up with a disease from them, is a disease on them or something, which they don't know is naturally. Then we are trying to get them from the grassroots and then try to educate them about it and then try to help them and then reduce the cramps, because most of them you see them crying very, very heavily due to the cramps, and then it avoids them from going to school, staying at home indoors, avoiding their friends, even avoiding their families, and then they're thinking that people will be laughing at them or something, but you do know that it's something is very natural to the females. Thank you very much, Marna, for the clarification more. Thank you very much. I will try to follow up because I just came across this in the period this organization on my Instagram. That's why I even joined the meeting here right now with you guys. Thank you very much.
Thank you so much for your question and for sharing your experience with us. We're right at the hour, so I wanted to pop in and thank our panelists again for being a part of Period Action Day and for their role in the menstrual equity space. Also a special thank you to Pandia Health, our Maxi sponsor, for their generous support. And I hope everyone who joined us feels equipped to begin exploring what their role may be in the menstrual equity space. You can start by learning about your own menstrual health, and please continue to take action and grow the movement. And you can visit periodactionday.com to engage with more of our efforts. Thank you all so much for joining us.